Military families are sounding the alarm about the presence of toxic mold in military housing. It's an issue that's long been making service members and their families sick. Stephanie Sy has our report on the ongoing problem and what is and isn't being done to address it.
The Pentagon acknowledged last year that there are serious health concerns related to base housing conditions, but families say the problems persist. Bills introduced in the House and Senate to address the problems so far haven't progressed. There are a host of reasons why military families may be disproportionately at risk for the ill effects of untreated mold infestations, and we'll get to that in a moment. But first, hear what several families told us about how they're affected.
I'm Erica Thompson, and I'm a 22-year military spouse. My husband is in the Air National Guard. We moved into military housing, and right away we noticed some issues with the HVAC system. And so we put in the proper service calls. They came out and said, actually, you need a new HVAC system, but we can't afford to replace it. And so they said, get a dehumidifier. We ended up buying 6 dehumidifiers, and we were dumping about 6 gallons of water a day just to keep it at 70% humidity in the house.
My name is Jenna Van Rokel. I am a military spouse. My husband's been in the military for the last 9 years. We have had 2 houses on base, and there has been multiple issues within each house. The first house had bugs and mold, and the second house was also filled with mold and bugs.
My name is Deborah Rampona Oliver, and I was an Air Force military spouse of 24 years. When we moved in, there were Rid-X damp pots everywhere to kind of like suck the moisture out of the air. We would notice that in the bathrooms and in the guest room, mold would begin to grow on the walls.
Kids started getting headaches and feeling nauseous in certain rooms of the house, and that was about 6 months into living there. Our dog started having seizures. Our 4-year-old dog that was healthy and in good shape, that was very different. All of a sudden seizures. Within 10 days, our son started passing out. So we're kind of all experiencing different medical issues and not understanding what's happening. I was experiencing some cardiac issues in the home and going to the doctor and trying to figure out what's happening.
It causes a multitude of health issues, some more severe, some not. Just on the non-severe side, headaches, exhaustion. On the more severe side, it caused our brand new baby at 12 days old to go into SVT. Highest beats per minute were 306. And she had to have life-saving care in an ambulance with a defibrillator and a NICU stay.
We had condensation on the walls. It was saturating my daughter's bed, which was up against the wall because the room was rather small. We had rats, and I have pictures of rat chew marks all along the bottom of the door, and then shavings from where they were chewing. We ended up buying our own dehumidifiers.
We noticed a huge amount of medical issues and symptoms after they opened the walls and replaced the windows. Kids started getting rashes on their faces and legs. We have 5 kids, and I homeschool, so we're at home most of the time. The headaches were increasing, the nausea was increasing, GI issues.
I started getting very, very sick, and I had always been a runner and always been very fit and was struggling to breathe. And I ended up in the ER several times at BAMC. And ultimately, we decided to get out of the military.
And then we also have our 5-year-old and our 6-year-old who have had reactive airway diseases from all the mold they've, consumed and breathed in. A lot of sleeping problems and anything that could go along with that.
This is not political. This is a basic right that somebody serving in the military should have healthy homes on base. The kids should be healthy.
Joining me now is Renee Klajic, a senior investigator at the Project on Government Oversight. She's spoken to a lot of military families about this issue over the years. Renee, there are hundreds of thousands of military families who live in base housing. How widespread is the mold problem, and how long has it been going on?
Housing advocates I've talked to have said that mold is the number one issue that these families are facing. And these advocates have worked with thousands of military families across the country. I've also spoken with an attorney who specializes in military housing cases. He says roughly 90% of his cases involve mold. The military knows that this is a big problem. I've done reporting on a coordinated effort that the Army undertook called Operation Countermold, where they were trying to battle mold in military housing and, figure out a way to tackle it more comprehensively. But when it comes to data, we're really lacking in accurate data that would convey the true scale of the mold problem.
As far as the pervasiveness, for what it's worth, Renee, a bipartisan bill to address this issue says, quote, thousands of military families living in privatized military housing have been exposed to hazardous environmental conditions, including widespread mold contamination due to negligent maintenance practices and inadequate government oversight. We contacted the Pentagon, by the way, and they have not responded. But what are advocates asking for? What have they told you about what families need most?
Well, military families face a lot of obstacles when it comes to seeking accountability and justice when, say, they've lost everything they own due to mold contamination. And the main thing that the housing advocates are working for is to try to make these families whole again in whatever form that means. Maybe it's, getting appropriate health coverage to ensure that the health issues that they've faced are being addressed, getting some financial remuneration for lost belongings, and also just getting them out of unsafe and unhealthy housing fundamentally. But like I said, there's been a lot of barriers with the housing companies in terms of making that happen.
Expand on that a little bit. Why is this problem so pervasive and hard to tackle, as opposed to how you might see it handled in the civilian world, where you're not talking about federally owned property?
Sure. So it's important to note that this problem is not new. Today, 99% of military family housing is owned and operated by private companies. The reason that we privatized military housing was because there were problems in the housing when it was run by the Pentagon. So back in the 90s, the Department of Defense privatized military housing because they had a $20 billion maintenance backlog, and they thought they could eliminate that maintenance backlog in housing and also save taxpayers money on the cost of military housing by injecting private capital. Unfortunately, neither of those things have come to pass. Today, my analysis has found that there's currently a nearly $7 billion maintenance backlog in military housing, and it's more than quadrupled since 2017. Also, there was a recent report by the Congressional Research Service that found that privatized military housing has ultimately been more expensive for taxpayers. I think it's important to know, there are some fundamental differences between housing when you live in civilian housing versus military housing. When you live in military housing, your landlord and your boss are in a business partnership. So when it comes to the potential for retaliation, which is something that I've heard from families that I've interviewed, there is a possibility that when a military family speaks out about housing issues and complains, their chain of command could get involved. They could face professional consequences for speaking out. So there's some very real disincentives for families to speak out and seek accountability. And that's just like one of those kind of unique factors of military housing.
There's no federal mold standard. Does that complicate legal recourse for families, some of which I know have tried to sue?
It absolutely makes it more difficult for the families to seek accountability through the courts. The absence of a federal mold standard for what is and isn't a safe level of mold in housing, makes it more difficult to prove like this is the cause of my problems. So that's a real problem that the families have faced. And you have to remember too that these families are going up against multi-billion-dollar real estate conglomerates in the courts. So they already face a wide range of hurdles when it comes to fighting these cases. And then in the absence of that federal mold standard, it just makes it all the more difficult.
That is Renee Klajic with the Project on Government Oversight. Thank you so much for joining us and sharing your reporting with our viewers.
Thank you for having me. Appreciate it.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.